Welcome everybody. This is Dr. Hani Nadim. This lecture covers the embryology of the genital system. Let's ask a question first. Where can a pregnant woman know whether her baby is a boy or a girl? Sex determination begins at the time of fertilization or in day 0, week 0 of pregnancy. You know that pregnancy extends over 40 weeks. Before the 6th week, it is still impossible to differentiate the sex of the baby. That's because we call this the indifferent stage. Just chromosomal analysis is the only way to know. If the baby is having XX, it's a female, XY is a male. Between the 6th week and the 12th week, differentiation takes place. So it's possible to tell the sex of the baby from examining an aborted child. But during pregnancy, it's impossible to tell by ultrasound before week 18. And it becomes more easy during the 24th week or the 6th month. Still yet, there is another way to tell the sex, is by amniocentesis and chromosomal analysis of exfoliated cells of the baby. If a bar body is present, this baby is a female. The intended learning outcomes will deal with the 3 components of the genital system, the gonad or the primary sex organ, the genital ducts and accessory glands. The 3rd component is the external genitalia. For each component, we will talk about the steps of development and the anomalies that may occur. The gonad in the indifferent stage comes from 2 sources, an endodermal source and a mesodermal source. The endodermal source is the germ cells, which are derived from the gut epithelium, close to the allantois, migrate to the hindgut, and migrate along the mesentery by amoeboid movement to reach the retrocoelomic space of the intermediate cell mass of mesoderm. Here we have the 2nd kidney, the mesonephros. So a swelling appears called the genital ridge, induced by the migrating nerve cells. The genital ridge enlarges. It lies on the medial aspect of the mesonephros and on the lateral aspect of the mesentery. So it's between the mesentery and mesonephros. The genital ridge develops by thickening of its coelomic epithelium. Its cells divide and invade the underlying mesoderm, making sex cords. Some of the germ cells are embedded in the sex cords. So each sex cord is made of endodermal germ cells and mesodermal cord cells coming from the coelomic epithelium. There is intervening soft mesoderm in between the sex cords. So the 3 components of the genital ridge are the coelomic epithelium, the sex cords, and the intervening mesoderm. Regarding times, the germ cells appear in the 4th week. They reach the genital ridge in the 6th week. Genital ridge begins to develop in the 5th week and becomes differentiated into the 3 components after arrival of the germ cells. It's very important to know that the germ cells are the inducers of the genital ridge. Now, these are the 3 components of the genital ridge, which lies between the mesonephros laterally here and the mesentery medially here. These are the sex cords made of 2 components of cells, endodermal germ cells and mesodermal cord cells. And this is the intervening mesoderm. derm. Now let's see how they develop into testis in the male and ovary in the female. The trigger for formation of testis and development into male is the presence of a Y chromosome. Absence of the Y chromosome, okay, will lead to development into a female, or the gonad into an ovary. So we can say that if there were no Y chromosomes, by default, the genital ridge will form an ovary and the individual will become a female. So in the Y chromosome, on the short limb of the Y, we have a gene called testis determining factor, TDF, or an sex determining region on the Y chromosome, or SRY. This will lead to formation of the testis in this way. The sex cords separate from the germinal epithelium, from the coelomic epithelium, I'm sorry, by a thick fibrous layer called tunica albuginea. They will form seminiferous cords that will branch and anastomose, giving a network called reed testis. These cords remain solid till puberty, where they become canalized together with the reed testis and establish communication with the mesonephric tubules, which will form the vasa efferentia. Okay, each seminiferous cord or seminiferous tubule is made of two types of cells. The endodermal germ cells will form spermatogonia. The mesodermal cord cells will form their supporting cells or nourishing cells called Sertoli cells. These Sertoli cells produce a hormone called Mullerian inhibiting hormone, or Mullerian inhibiting factor. And as I just said, the coelomic epithelium is separated from the cords by tunica albuginea. Now, the mesoderm in between will form the stroma, that is to say the capsule and septa that divide the testis into compartments, and will form the endocrine cells situated here that are called interstitial cells of Leydig that produce testosterone. And now you have to remember two things. First, that the testis produces two hormones, one from the Sertoli cells, it's the Mullerian inhibiting factor, one from the interstitial cells of Leydig, which is testosterone. Second thing you need to remember is that two things occur at the age of puberty. Canalization of the solid seminiferous system, making seminiferous tubules in reed testis canalized, and establishment of communication between the reed testis and the vasa efferentia that come from the mesonephros. In the case of the female, the sex cords, the first generation of sex cords degenerates, forming something in the medulla of the ovary, rudimentary things called reed ovarii. And the second generation of cords develop and separate to form follicles. The follicles are made of oogonia inside, coming from the endodermal germ cells. These undergo enlargement, forming primary oocytes, which enter the first meiotic division and become arrested in prophase till the age of puberty. The second type of cells are follicular cells that surround the oocyte. These follicular cells come from the mesodermal cord cells. Now, there is very thin tunica albuginea in the ovary. The germinal epithelium, the coelomic epithelium will form germinal epithelium on the outer surface of the ovary. The stroma will also, the mesoderm will form the stroma together with the endocrine cells of the ovary that are called theca interna cells. In this video, we will see how the gonads are formed, first in different stage. Here is the embryo. We see inside it the gut with these are the germ cells migrating along the mesentery to induce the formation of the genital ridge. Now we will have a cross section here and look into it. Okay. These are the migrating germ cells. Here is the genital ridge, and here is the mesonephros. Now sex cords appear with mesoderm in between, and the germ cells embed themselves in the sex cords, and here is the coelomic epithelium. In the case of the testis, the coelomic epithelium becomes separated from the cords by thick tunica albuginea. The cords form seminiferous cords and reach testis, which will later be canalized and establish communication with the vasa efferentia. In the case of the ovary, here we are again, similar appearance of the indifferent stage. Well, the first generation of cords will make the reed ovarii. Second will make follicles made of two types of cells, oogonia inside and follicular cells around. In either case, whether male or female, the developed gonad will descend. In the beginning, in the indifferent stage, the gonad is high up in the abdomen, just under the diaphragm, opposite the level of L1. It receives its blood supply by gonadal artery from the aorta. Its lower pole is connected to the external genitalia through the anterior abdominal wall by a fibrous cord called the gubernaculum. And in front of the gubernaculum, a pouch of coelom or peritoneum descends into the external genitalia, forming what's called processus vaginalis. You have to notice that the formation of the processus vaginalis precedes the descent of the ovary, and it occurs in both male and female. Well, how these things proceed? Well, descent of the testis is both internal, inside the abdomen till the deep inguinal ring, and external through the inguinal canal to the scrotum. Descent in the female is internal only to the pelvis. Okay, internal descent occurs until at the third month of pregnancy. The testis is located in the region of the deep inguinal ring. The mechanism of this descent is passive one, as the gubernaculum retains its length while the abdomen enlarges, so that the testis or the ovary gradually acquires a relatively lower position within the abdominal cavity. To make this more understandable, imagine that you have an inflated balloon with helium, so it's flying up, but it is fixed to the floor by a wire or a thread, and this has a constant length. Well, imagine that the room was inflated so that its roof ascends upwards. It becomes enlarged, and this is what happens to the abdominal cavity. It becomes larger, while the testis or ovary is connected by this string to the floor. So as the roof goes up, the testis gradually becomes lower and the roof becomes higher. So that's why we call it a relative positional change. External descent, on the other hand, is an active process. The testis stays from the third month till the 7th month at the deep ring, waiting. But during the 8th month, it descends through the inguinal canal to reach the scrotum. This is by shortening of the gubernaculum. It's an active process. At first, fibrous elements in the gubernaculum undergo degeneration, so it becomes shorter, and muscular elements become contracted under the effect of the human chorionic gonadotrophin. What happens to the gubernaculum and the processus vaginalis? The gubernaculum becomes very short. It connects the testis to the scrotum, so it won't be pulled upwards again in the inguinal canal. The processus vaginalis, its lower part remains patent, forming the tunica vaginalis in front of the testis, and its upper part becomes obliterated, forming the vestige of processus vaginalis, which makes one of the components of the spermatic cord. The testis invaginates the tunica vaginalis from its back, so it's covered from every aspect, anterior border, both surfaces, upper and lower pole, except its posterior border. In the case of the female, descent occurs internally only, so it's a passive process. At the 3rd month, the testis is in the false pelvis or the iliac fossa. Postnatally, it descends to the true pelvis. The gubernaculum is relatively longer in comparison to the male. It becomes adherent to the developing uterus at its cornea, this angle. So it becomes divided into 2 parts. Part between the ovary and cornea of uterus called ovarian ligament, and part between the cornea of uterus and the external genitalia running through the inguinal canal. This part is called round ligament of the uterus. How about the processus vaginalis? It is formed in the female as it is formed in the male, but it becomes obliterated, forming the canal of Nack, and later it disappears. Okay, in this video, we are going to watch the descent of the gonads. Here is the formation of processus vaginalis, the descent of the testis internally, then the external descent through shortening of the gubernaculum behind the formed processus vaginalis. Later, this part makes the vestige. This is the tunica vaginalis. The testis invaginates it from the back. In the case of the ovary, the descent is only internal. As you can see, it was in the abdomen. Here is the gubernaculum. Here is the developing fallopian tube and the uterus. As it descends, the gubernaculum becomes divided into ovarian ligament and round ligament of the uterus. The anomalies that may occur to the testis are either anomalies of descent or anomalies of formation or anomalies of the processus vaginalis. At first, anomalies of descent, we may have undescended testis. Typically, the external descent occurs during the 8th month. The ratio of undescended testis in full term is low. It's only 3%, while in prematures, it is higher. It is 30%. Remember the number 3 here. If the testis has not descended into the scrotum, we wait till the 3rd month. It may descend during that period by itself. If not, it becomes permanent. It will not descend by itself, so we should not wait. We have to intervene here. Why we don't leave it alone? Because if this boy reaches the age of puberty, the intra-abdominal high temperature will prevent spermatogenesis, and this person will become sterile. So we have to give treatment, injections of human chorionic gonadotrophins, which are taken from the placenta after delivery. Usually factories extract this hormone from the placenta. If this hormone does not give any response and the testis remains high up in the abdomen, we have to surgically remove it. We do excision. Why? We don't leave it alone. Because it has higher risk of becoming malignant. The undescended testis is vulnerable to cancer formation. Another condition is called mal-descended testis. The testis descends but to abnormal positions. It may occupy several places. It may be at the root of the penis. It may be in the perineum. It may be in the front of the thigh. In such places, the testis is exposed to trauma. That's why we intervene surgically, although it descends outside of the inguinal canal. So probably there is nothing to do with malignancy or infertility here, but we intervene surgically to fix it in the scrotum because it is exposed to external trauma. Sometimes there is agenesis of the testis, or sometimes there is formation of double testis. That is to say, double testis in one scrotal half, and maybe one or two in the other half. Well, agenesis occurs because of failure of the germ cells to arrive at the site of the formation of the genital ridge, because they induce its formation. So let me ask you a question. Can you find a testis developing without sperms, without spermatogonia in it, without germ cells in it? No way, because these cells are the reason or the stimulus for its formation. Well, another condition is called polycystic testis. In such case, the testis is filled with multiple cysts that are filled with sperms. Why this condition occurs? As I told you before, as the seminiferous cords become canalized, forming the seminiferous tubules, and the red testis becomes canalized, and it establishes communication with the vasa efferentia derived from the mesonephros. If these fail to unite together, there will be polycystic testis, similar to polycystic kidney. Failure of a union of the nephrons with the collecting ducts. Here it is due to failure of connection of the red testis with the vasa efferentia. This person will be sterile. If he does semen analysis, the report will come azoospermia. But if we do testicular biopsy, the testis is filled with sperms. So we can extract the sperms from the cysts and do artificial insemination to the wife. The two remaining anomalies are due to problems in the processus vaginalis. The first one, that the vestige remains open, so there is collection of fluid in the tunica vaginalis called hydrocele, okay? Or there is part of it that remains open, it make what's called spermatic cyst. I'm sorry, it will make a cyst in the spermatic cord. The other condition is that the processus vaginalis remains patent, connected to the abdominal peritoneal cavity, and the intestine may pass through it, causing congenital inguinal hernia. Now, I'll ask you a question. What are the sources of these cells in the testis? Spermatogonia, Sertoli cells, interstitial cells of Leydig. And a second question that I will ask you, how many hormones are produced by the testis? So I advise you to stop the video right now and then come back and listen to the answer. Okay, you're back. The spermatogonia come from the endodermal germ cells. Sertoli cells come from mesodermal cord cells, correct? And the interstitial cells of leading, they come from the stroma or the intervening mesoderm. How many hormones are produced? 2. Sertoli cells produce Mullerian inhibiting hormone, MIH, and the leading cells produce testosterone. Now we'll come to the development of the second component, the genital ducts. 2 duct systems develop in either sex lateral to the developing gonad. These are the mesonephric duct system or the Wolffian system, marked here in red, and lateral to it there is paramesonephric duct system or Mullerian system. This has been described by Wolff. This has been described by Muller. The mesoderm, as you know, the mesonephros, as you know, is the second kidney to develop. It is made of 70 tubules collecting to one duct, the mesonephric duct, that opens in the back of the ventral part of the cloaca or the urogenital sinus. Again, the paramesonephric duct develops as invagination in the coelomic epithelium, called coelomic groove. From its caudal end, a solid cord develops behind the coelom or the peritoneum, curves medially in front of the mesonephric duct, then curves and descends caudally close to its fellow of the opposite side, where they unite together to form what is called uterovaginal canal that bulges in the back of the urogenital sinus, making what's called Muller's tubercle or Mullerian tubercle. So this paramesonephric duct has a proximal part, vertical and horizontal, which is separate on the 2 sides, while the caudal portion, the caudal vertical portion, unites with its fellow of the opposite side, making one structure, the uterovaginal primordium. How these 2 duct systems develop in the male and in the female, as a matter of fact, in each sex, one duct system develops and the other regresses, and the opposite occurs in the other sex. Let's see in the male, what is the condition here? Well, in the male, we have 2 things. We have testosterone and we have the Mullerian inhibiting factor. Testosterone makes the mesonephros grows, okay, making the male genital duct system. The Mullerian inhibiting hormone causes the paramesonephric duct to regress. All right. What does this mesonephric duct system give? At first, from the 70 mesonephric tubules, the middle ones will make the vasa efferentia, which are connected to the epididymis. They connect the reed testis with the epididymis. Okay, and some embryonic remnants remain. One duct here above, it's called superior aberrant ductule. It's connected to the reed testis. Another duct caudally here below the vasa efferentia, it's called inferior aberrant ductule. It's connected to the duct of epididymis. And some ducts that are connected neither to the reed testis nor to the duct of the epididymis, they are called paradidymis. Okay, how about the one duct, the mesonephric duct? Well, it will develop into the male duct system. It will form the epididymis, the body and tail of epididymis, all right? It will continue as the vas deferens, okay? And from its proximal end, the seminal vesicle arises as a bud, I'm sorry, from its distal end, its proximal end is near to the testis. From its distal end, the ejaculatory duct buds out, and what remains here will form the ejaculatory duct. In addition to this, it makes some urinary structures, the ureteric bud and the trigone of the urinary bladder. Okay, let's see what happens to this blue paramesonephric or Mullerian duct system. It will regress because of the Mullerian inhibiting factor or Mullerian inhibiting hormone that is produced by Sertoli cells. It will give some embryonic vestiges. Its proximal part will give just a small appendix resting on the upper pole of the testis called appendix of the testis, while its distal end here within the prostate will form the prostatic utricle, which corresponds to the uterus of the female. That's why it's called utricle or small uterus. The rest of the duct between the appendix and the utricle, the remaining of the paramesonephric duct will disappear totally. So just its proximal end and its caudal end will remain, giving embryonic remains. How about the Mullerian tubercle? It will give the seminal colliculus in the back of the prostatic urethra, where the two ejaculatory ducts open on the sides with the prostatic utricle in between them. Okay, let's see what happens in the female. In the female, we don't have either testosterone or Mullerian inhibiting factor. These two hormones are absent. So if these two hormones are absent, by default, the development will go towards the female development track. So remember, development in the male is an active process due to presence of certain factors. It's either the presence of the Y chromosome, the testis determining factor, or the presence of the two hormones produced by the testis, testosterone and Mullerian inhibiting factor. In the female, the development of gonad is a passive process due to absence of the Y chromosome. Development of genital ducts is passive process due to absence of testosterone and Mullerian inhibiting factor. So by default, if these factors are absent, all individuals would become females. So when there is no testosterone, the red duct system, the mesonephros, will regress. What would it give here? It would give just small ducts in relation to the ovary here, called epiophoron and paraophoron. They are present in the broad ligament. And the duct, the mesonephric duct, will make a duct under the fallopian tube on the side of the uterus and vagina called Gartner duct. Plus it gives some urinary structures, which are the trigone of the urinary bladder and the ureteric bud. How about the paramesonephric duct system here? Okay. It will give the genital duct or the internal genitalia of the female. What would it give? These free portions here, the proximal parts of the paramesonephric ducts, will make the fallopian tubes. Its coelomic groove here, okay, will give the abdominal ostium of the fallopian tube, and fimbria develop around it. Okay, the uterovaginal canal that is fused here would have a septum at the beginning, and then this septum will disappear, making one canal that will give the uterus and upper part of the vagina, probably the upper 1/3 or the region of the fornices of the vagina. Okay, the site of the Mullerian tubercle will give the hymen or the membrane that closes the lower end of the vagina. Well, we said that it will give the upper third of the vagina. Well, where the lower 2/3 are coming from, we'll see now. Okay, Where does the lower 2/3 of the vagina come from? We'll see now. I just told you that there is a Mullerian tubercle that bulges in the back of the urogenital sinus. And we said that the upper 2/3, upper 1/3 of the vagina comes from the united uterovaginal canal. The lower third comes from two outgrowths from the endoderm of the back of urogenital sinus called sinovaginal bulbs. As a matter of fact, when the paramesonephric duct comes in contact with the wall of the urogenital sinus, it induces it to make these two bulges or sinovaginal bulbs. Now, this is a second induction that we talk about. The first one was the the germ cells inducing the formation of genital ridge. Now, the second induction is induction by paramesonephric duct to the formation of the sinovaginal bulbs. These two bulbs keep growing, pushing the uterovaginal canal away from the site of the Mullerian tubercle. These two bulbs fuse together to form a flat vaginal plate, flattened ventrodorsally. Now, this vaginal plate becomes canalized, okay, communicating with the upper part of the the lower part of the uterovaginal canal here, and communicating with the urogenital sinus below to establish the hymen, which has a central hole. So at the site of the original Mullerian tubercle, the hymen develops. The upper part of the vagina comes from paramesonephric duct system. The lower 2/3 of the vagina come from sinovaginal bulbs of the urogenital sinus, or it comes from endoderm. This is mesoderm, this is endoderm. Okay, now we'll talk about development of accessory glands, the bulbourethral gland and prostate in the male, the Bartholin gland and Skene's glands in the female. This is the mesonephric duct. This is the mesonephric duct here. This is the ureteric bud. This is the ventral part of the cloaca or urogenital sinus, divided into a vesical part, pelvic part, and phallic part. Okay, from the pelvic part, buds will give a gland, and from the phallic part, buds will give a gland in either sex. Okay, in the male, here we are, this vesical portion will form most of the bladder, and in the female, most of the bladder and the urethra, except the trigone, which comes from the absorbed mesonephric duct. Now, this is the pelvic part and phallic part. Together, both will form the vestibule of the vulva. Here, the ducts, the buds that come out from the phallic part will make the Bartholin gland or great vestibular gland, and buds that come out from the pelvic part will make urethral glands on the sides of the urethra. These are called Skene's glands. Bartholin ducts are on the sides of the developing vagina. In case of the male, from the pelvic part, about 15 small buds arise, unite together with stroma to make the prostate gland, and the buds that arise from the phallic part will make the Cowper's glands. Now, this video animation will explain more the formation of the genital ducts and glands. We'll start with the indifferent phase. We can see here the two duct systems developing lateral to the gonad. This red one is the paramesonephric duct, and the blue one is the mesonephric duct. the two paramesonephric ducts unite here to form the uterovaginal canal, and both open on the back of urogenital sinus. In the male, we will see that here is the developing testis, and this is the mesonephros and the paramesonephros. Okay, we can see that the mesonephros forms the vasa efferentia, the epididymis, the vas deferens, and now the testis will descend while the kidney will ascend. The formation of the accessory glands in the pelvic region, we can see here the urogenital sinus. This is the vesical part, the pelvic part, phallic part. Buds arise from the pelvic part here to form the prostate gland, and buds from the phallic part form the Cowper's glands. This is the mesonephros, and this is the ureteric bud. Okay, now in the female, we can see here that the two duct systems, this mesonephros regresses to form epiforum, paraoforum, and Gardner duct. The paramesonephros forms the fallopian tube and the uterovaginal primordium here. The fallopian tube and ovary here descend. The uterovaginal primordium induces the urogenital sinus to form the vaginal plate that grows caudally, that grows upwards, as you can see. Now we will see the anomalies that occur to the duct system, especially in the female. They are either paramesonephric anomalies or mesonephric anomalies. Paramesonephric anomalies occur due to one of four causes: either failure of fusion, aplasia, or hypoplasia, and failure of canalization. Failure of fusion, at its maximum form, there are two uteruses and two vaginae. This is called uterus didelphys. There may be two uteri and one vagina. This is called uterus bicornis. There is sometimes a rudimentary horn of this uterus bicornis, so it's called uterus bicornis unicolis. So this is a combination of a failure of fusion and hypoplasia. Sometimes there is just a septum inside the uterus. There is fusion, but it's incomplete. This is called uterus septatus. Sometimes there is just a depression at the region of the fundus. It's called uterus arcuatus. Of course, all of these anomalies interfere with pregnancy, but sometimes pregnancy occurs I've heard about pregnancy occurring in uterus bicornis, and strangely, this lady gave birth to a twin. Sometimes there is double vagina and maybe single uterus. How can this be explained? Because we had two sinovaginal bulbs that united together forming a vaginal plate. If they fail to fuse, there will be a septum in the vagina. Now, aplasia of one horn leads to what's called uterus unicornis, one horn only with one fallopian tube. The other side is totally absent. Sometimes there is hypoplasia of the uterus. A hypoplastic uterus will have reversed ratios between the body and cervix of the uterus. Typically, the body is double the size of the cervix. Here, the cervix is double the size of the body, which is very small. But good enough that giving progesterone to this lady will enlarge the uterus, and pregnancy later becomes possible. Failure of canalization may be either atresia of the cervix or imperforate hymen. In the case of imperforate hymen, at the time of first menstruation, that's called menarche, blood is accumulated in the vagina. Every month, more blood is accumulated. The vagina enlarges, and this is called hematocolpos. It is treated by making an incision, but draining the blood very slowly, so shock will not occur to the poor girl. Mesonephric anomalies occur also in the female or male. In the male, it may lead to spermatic cysts. In the female, it leads to Gardner's cysts, either spermatic cyst or pseudospermatic cysts. Pseudospermatic cysts occurs in the embryonic anomalies, the superior aberrant ductule, inferior aberrant ductule, the paradidymis, because they don't contain sperms, while spermatic cysts occur due to enlargement of some of the vasa efferentia, leading to cyst filled with sperms. Now, what are the counterparts in the female of mesonephric and para-mesonephric system? The mesonephric gives rudimentary structures, epiofrum, paraofrum, Gardner duct. Paramesonephric will form the female genital duct, the fallopian tubes, the uterus, and the upper part of vagina. Now we will explain the development of external genitalia. In different stage, we have these swellings. What's called genital tubercle, and phallus. We have genital folds or urethral folds, and we have two genital swellings or labioscrotal swellings. So all are called genital. That's the easier way to remember them. Genital tubercle, genital folds, genital swellings. Okay, let's see what they give in the female and in the male. We start with the female because almost very minor changes occur to them. The phallus becomes small to form the clitoris, and the genital tubercle will form its glands. Okay, the two urethral folds or genital folds remain separate from each other, surrounding the vaginal vestibule that is derived from the urogenital sinus, and they make the labia minora. The vaginal vestibule receives the following openings: the urethral opening anteriorly, the vaginal orifice surrounded, partially closed by the hymen. On the sides of the urethral orifice, there are openings of Skene's glands. On the sides of the vaginal orifice, there are openings of Bartholin glands. Now, the genital swellings or labioscrotal swellings will give the labia major. So the fate is clitoris, labia minora, and labia major. In the case of the male, the phallus elongates to make the penis. The genital tubercle will make its glands. The two urethral folds, genital folds, unite together at the bottom of the penis to close the urethra, and the genital swellings or labioscrotal swellings will give the scrotum, the two halves of the scrotum, which have a septum in between. So what corresponds to the glands of the penis is the glands of clitoris. The penis itself is the clitoris. What corresponds to the labia minora, the raphe on the undersurface of the penis and scrotum. What corresponds to the labia majora, the scrotum. Okay, this is an animation to show the closure of the urethral orifice, the urethral groove from the bottom. As a matter of fact, the formation of the urethral groove is a bit more complicated than this. At first, there is a primary urethral groove here between the two urethral folds, genital folds. This is the phallus and the glands, and these are the scrotal swellings. Okay. The urethral groove is at first primary, lined by ectoderm on the undersurface of the penis. Later, with rupture of the urogenital membrane, endoderm creeps to line it. Okay, this endoderm appears here yellow, forming what's called the urethral plate, and this gives the secondary or definitive urethral groove. And then the two urethral folds become united from caudal to cranial to close the urethral groove, leaving the primary external urethral meatus on the undersurface of the penis between the glands and body. Later, an ectodermal growth invades the glands. It becomes canalized to form the terminal part of the urethra or the fossa navicularis. And now the urethra unites with the fossa navicularis, and now the definitive external urethral meatus moves from the undersurface of the penis to its tip. A further death of cells occurs in the region of the glands under this skin, which will form the prepuce. The prepuce is separated from the glands by space, and it is this space is interrupted at the bottom here with a fold called the frenulum. This prepuce can be retracted to show the glands and can be removed with circumcision. Now, in this video, we'll see the development of the external genitalia at the indifferent stage at first. This is the genital tubercle, the genital folds, genital swellings. And now, here we are forming the phallus. In the female, it's easy. The genital tubercle forms the glands of clitoris. Here, the urethral folds will form the labia minora. The labioscrotal swellings will form the labia majora. It's more complicated in the case of the male. The genital tubercle will form the glands. The phallus itself will form the penis. The labioscrotal swellings will form the scrotum. And now we can see the urethral groove in the various places on the undersurface of the penis. Here, closure started, so it appears closed. In the region where it's open, it appears below. Here, the corpora cavernosa and spongiosa develop within the body of the penis. Okay, if we have a cut section here, we can see the canalization of the solid ectoderm here, making fossa navicularis, and canalization around here, creating the prepuce of the penis. Now, the anomalies of the penis include an opening on the undersurface called hypospadias, which may occupy several places due to faulty closure of the urethral groove. It may be glandular, it may be coronal, it may be corporal or penile, it may be penoscrotal, it may be scrotal. There is another condition which is epispadias. It's usually associated with ectopia vasica, and it was explained in the video of the development of the urinary system. Other anomalies of the penis include micropenis, absent penis due to agenesis, or maybe double or bifid penis. Now we will talk about what's called hermaphrodites and intersex. True hermaphrodites, where the person is having both gonads, male and female, is very rare, if ever occurs. Pseudohermaphroditism is more common. It's either male pseudohermaphroditism or female pseudohermaphroditism. We call male or female based on the presence of the primary sex organ and the genes, the chromosomes, I'm sorry. If the person is having a Y chromosome, then this is male pseudohermaphroditism. If there is no Y chromosome, only X, maybe one X, two X's, three X's or more, this is a female pseudohermaphrodite. Sometimes the phenotype or the external appearance is not similar or matching with the true type. So it's in case of male pseudohermaphroditism, a condition called testicular feminization syndrome, as you can see here. This person is XY. He has a testis, but it's undescended. It produces testosterone, but the receptors for testosterone are absent or deficient in the body, or defective maybe. There is no effect of such testosterone, so the external appearance is typical of a female, as you can see here. So there is a testis, but it's hidden inside the body. The phenotype and external genitalia and everything else looks like a female. This person may live till puberty or after without knowing, thinking that she is a female. However, there is no menstruation because there is no secondary sexual character. There is no genital duct system, no uterus. There is rudimentary vagina, but external appearance, it's like a female. There is external female genital organs, no fusion, because there is no elongation of phallus, no closure of urethral groove, so it appears like a female clitoris, labia minora, labia majora, but the duct system is not developed. No fallopian tubes, no uterus. Okay, so the other case is an XX person, but having a male external appearance, a male phenotype. So the phenotype is like a male. The gonad is an ovary, right? And the cause is a tumor of the zona reticularis of the adrenal gland, producing testosterone in excess. Testosterone causes the external appearance of genitalia similar to male. The clitoris is enlarged to appear like a small penis. The two labia majora are almost fused, forming what looks like a scrotum. Now, in summary, in the development of the gonads, the three components are the sex cords, the intervening mesoderm, and the coelomic epithelium. The sex cords are one generation, giving seminiferous tubules and reed testis in the male. In the female, two generations. The second makes the follicles. The first makes rudimentary reed ovarii. Inside the cords, the germ cells give spermatogonia in the male, oogonia in the female. The cord cells form Sertoli cells in the male, producing Mullerian inhibiting substance, and follicular cells in the female. The mesoderm in between will make the stroma and endocrine cells, the interstitial cells of Leydig. Here it will make the stroma and theca cells. Tunica albuginea in the male is thick, in the female is thin. Coelomic epithelium in the male will make mesothelium, in the female will make germinal epithelium. Regarding descent of the gonad, we have a gubernaculum connecting the lower pole of the gonad, and we have processus vaginalis making the inguinal canal, and two types of descent. The gubernaculum in the female becomes very small, or we may say disappears. It makes two ligaments here connected at the cornea of the uterus, ligament of ovary, and round ligament of uterus. Processus vaginalis makes tunica vaginalis and vestige in the male. Totally disappears after forming canal of Knock in female. The descent in the male is internal and external. In the female, it's only internal. Regarding the duct system, we have two systems, the Wolffian and the Mullerian, mesonephric and paramesonephric. In the male, the mesonephric enlarges, the paramesonephric regresses due to Mullerian inhibiting substance. Enlargement here is by testosterone, leading to the duct system in the male, the epididymis, the vas deferens, ejaculatory duct, and seminal vesicle, and other structures, rudimentary and so on. In the female, it regresses and giving some rudimentary structures, epioform, paraoform, and Gartner's duct, while the paramesonephros here regresses, forming two structures, one at the testis, the appendix, and the other one in the prostate, the prostatic utricle. Here it gives the two fallopian tubes, the uterus, upper part of vagina, whereas the lower part of the vagina comes from the endoderm of the urogenital sinus, two sinovaginal bulbs, fusing, making vaginal plate, which becomes canalized. Finally, the external genitalia, three elements: genital tubercle forming phallus, urethral folds, labioscrotal swellings. The genital tubercles will form the penis and its glands. Here it will make the clitoris and its glands. The urethral folds fuse together on the undersurface of penis, closing the secondary urethral groove. Here they remain separate, forming labia minora. The labioscrotal swellings, from their name, they make the scrotum in the male and the labia majora in the female. Now we reach the end of this lecture. Thank you for listening. If you like these lectures, please subscribe to my YouTube channel and hit like. Thanks again.